There are several tests that your physician may order, including MRI. This is an imaging test that will visualize many details of your spine, including arthritic spurs, disc herniation, or spinal stenosis, or narrowing of the spine. You will be placed in a narrow MRI scan tube. The images of your spine may take up to 30 minutes to obtain. The MRI technician will send your images electronically to your physician's office. You may be unable to undergo this test if you have a pacemaker or metal in your body. 15% of patients are claustrophobic or have a fear of tight or closed spaces in the MRI scanner and may require sedation 1 hour before the test is performed. You may also need a CT myelogram. This test is performed in the radiology department by a qualified neuroradiologist, a physician who has specialized in interpreting X-rays taken of the spine. You will be placed on your face on a tilting X-ray table. Your lower back will be washed and scrubbed with an antiseptic soap. A local anesthetic is injected into your lower back using a small needle. A colorless dye is injected into the spine through a needle, and this dye floats throughout your spinal canal, during which time X-rays are taken in different positions. The needle is removed as soon as the dye is injected. The table is tilted into a head-down position that alternates with a standing position. After an adequate number of X-rays are taken, you are taken off the X-ray tilt table and transferred by stretcher to the CT scan suite. You will be placed on your back and CT scans will be taken of your spine for approximately 10 minutes. You will be taken back to your room in the outpatient area and discharged from the hospital within 2 hours after the CT myelogram is completed. An appointment may be made for you to be seen by your physician immediately after discharge. You may also have an EMG. This test is performed by a neurologist who specializes in diseases of the nerves and muscles. You will have small needles or electrodes applied to your arms or legs. Mild electrical impulses will be applied through the electrodes and recorded from the needles into a computer-type recording device. Interpretation of this test is made by the neurologist by the sound made by muscles during stimulation and by the tracing obtained on the computer screen. The test will indicate whether your symptoms are arising from a spinal nerve or a nerve in the arm or leg. This test provides supporting evidence to the MRI and CT myelogram that may be necessary in making a precise decision as to whether surgery is required. After your tests are completed, you will have a follow-up with your physician. The physician will discuss the results of the test performed with you and make a recommendation as to the most appropriate treatment. The recommendation may consist of no specific treatment, medications alone, physical therapy, epidural blocks, or surgery. If surgery is decided upon, your physician will discuss the proposed operation with you, including the potential risks, anticipated duration of hospitalization, and how to prepare for the operation. You will be given a written handout documenting this information when you leave the office. The treatment chosen will be scheduled by the office staff after your insurance has approved the treatment.